Hi, good afternoon, and thanks, Dr. Hoda, for a great overview. Dr. Hoda has been an amazing leader for us through this pandemic, and what I wanted to talk about was some of the changes in the way that care is provided during this pandemic. And so if we go to the first slide, you may not know this slide is animated, that on average, in our last year in UHN, which is University Health Network, is like many other hospitals that thousands of people visit us for an appointment each week, that we're typically operating at 105% of our planned occupancy, and we have close to 4,000 procedures going on. In the middle of the pandemic, all of a sudden, our hospital occupancy was occupied at about 65%. Our ICU, of course, was almost full with COVID patients, and all elective surgeries had been postponed, and we're down to about a third of what we normally do, and visits to the emergency room were 30 to 50% of the normal. So the question really is, what happened to all the patients? How are people getting care during this challenging time where you cannot visit? And so if we go to the next slide, we recognized immediately that COVID created a number of challenges for us in the healthcare environment. People were afraid of going to the emergency room, which we are concerned about because people with other illnesses, cancer, congestive heart failure, infections, may not show up when they really should be showing up. We knew that many of the outpatient clinics had closed to visits. There were no visitors and family members in hospitals, and we know they play an important role in advocating for their family members as well as providing some incidental care. We also had a problem in that we didn't have enough initially personal protective equipment to open up those offices. And of course, right at the start, we had limited access to the ability to securely and privately connect with people in video conference network. So really, over the next few minutes, if we go to the next slide, what I really wanted to quickly give you an overview of how do you get your healthcare during this pandemic? Some of the do's and don'ts of telehealth, and how you can prepare for help your healthcare professional, your physician, your nurse practitioner, and some of the things that exist right now that you can use. And talk a little bit about our field of rehabilitation and some of the things we're thinking about. And finally, just sort of how you might be able to support us in this journey. So if we go to the next slide. One thing we do want to leave you with is a lot of people are afraid of going to the emergency room, but you should be going to the emergency room. Most emergency rooms are available. You can call ahead if you're really worried to telehealth, but ERs have made a lot of efforts to isolate people who have suspected COVID. We created a virtual COVID assessment room, which included a camera, and people were able to take their own blood pressure and oxygen, and it'll really allow people to be protected and isolated from exposure. And we're really concerned, as I mentioned, that if people delay getting the help they need, that their condition will worsen. Go to the next slide. So you should also, if you have a condition you need help for, you should contact your healthcare professional, your family physician. The Ministry of Health, to its credit, quickly created a new fee code which allows doctors to do assessments over the phone. This didn't exist before the pandemic. We know that also the Ontario Telehealth Network has rapidly implemented a system that people can connect with their individual computers. And of course, many of you will be familiar with Zoom, and it's a private way of connecting with people. And we do still have in-person visits. Our numbers are about a quarter of what they normally would be. But for urgent matters, we still bring people in and we give them the appropriate PPE when needed. So it's important you do contact your healthcare. So here's some of the things that virtual visits are good, that are safe. We know that there's good evidence that mental health issues can be dealt with using video conferencing and virtual care. Many skin problems through photographs can be helped. Minor infections, urinary or sinus can be dealt with, sore throats, eye redness, sexual health issues, travel-related health care, and a number of things can be monitored using home devices and lab tests. And certainly doctors can review those results with you over the phone or video conference. Some of the things that telehealth is challenged with If you have chest pain, shortness of breath, loss of vision, loss of hearing, or sudden weakness or numbness suggestive of a stroke or a neurological condition, you need to go to an emergency department. If you have a really bad cough, obviously your doctor can't listen to your chest, and this is a challenge. If you have abdominal problems, then or digestive problems, this may be hard to diagnose, as well as if you have a fall or a fracture, it's going to be awfully hard to make sure that it's safe without imaging. And similarly, examining your ear is challenging using video conferencing. So, how you can help? Well, we would like you to come prepared for your visits with a list of your symptoms, when they started, any data that you have recorded from your home monitors. We're going to talk about that in a moment. Information about any contacts with similar symptoms so that we can do contact tracing. And if you haven't seen that doctor who you've got talking to, obviously a relevant health history. And it's always critical to bring your prescription medications. And if you don't have a list, then have your pill containers at hand. Go to the next slide. So obviously there's a number of pieces of equipment. Some of these are now smart, they're internet enabled. We have blood pressure cuffs that are really reasonably priced. They range now between $50 and $80. You can even get them less expensive, and they're a great way of monitoring your pulse and your blood pressure. You have, for those people who have conditions like congestive heart failure where they need to monitor their weight scales, thermometers. There's the simple ones like shown, or there's the ear ones that you can purchase. And of course, we increasingly see heart monitors that are working and doing a lot of the work that we would do as clinicians that are existing, and certainly a lot of work going on at UHN from some of our cardiology colleagues on monitoring people at home. Dr. Heather Ross is a leader in this field. If we go to the next slide. There's also a number of apps for healthcare. Obviously, it's really hard to know which one is good and which one's not so good. That's why in our field in rehabilitation, there's a great group in the UK who've come up with a website called MyTherapy, which is a rating where they rate the quality of apps, and they have many, many apps that are good for stroke, blood pressure, health monitoring, and they really do a nice job of rating them and telling you what it does. I would encourage you, if you're looking for some health apps, to consider this one because it is well done. The next slide. So we know that we immediately had closure of our outpatient rehab. It was very difficult, and our therapists had very rarely been using technology on a day-to-day basis for this, and they had some concerns about this. This picture of Nina, you can see, who is one of our therapists. She's actively working with one of our patients, and we know that we have concerns about safety. Obviously monitoring people's effort. Normally, you can tell how much muscle tone there is, and effort, and their blood pressure, and we of course worry about falls. From the perspective of people who are receiving tele-rehab, obviously they have to set up the technology. They also have to make sure that the exercise they do are safe and balanced. Unfortunately, many people, because of cognitive difficulties or other things, need a caregiver to help them set up the equipment, and many of them are not technologically savvy, and this has been a challenge for us. And of course, you don't have the same quality of exercise equipment in the home. If we go to the next slide. This is some of the work that we've done through the support of the Toronto Rehab Foundation, as well as research granting agencies at the KITE, which is the Rehab Research Institute at Toronto Rehab. We've developed sensors for tests that you can take home. This mask, you wear this mask on your face, and it can diagnose sleep apnea. This SensiMat is a pressure sensor that connects to your mobile phone for people with spinal cord injury or stroke who may not recognize that they can't feel that they're developing skin breakdown. This SensiMat will tell them that they've spent too much time or that there's pressure that might be worrisome for skin breakdown. Take it to the next slide. Dr. Andrea Iavoni, who's a geriatric psychiatrist with us and a researcher, is one of the leaders of the Ambient Project, where we're doing automated monitoring of individuals on our specialized dementia unit and looking for people who are at high risk of falls, as well as restlessness and agitation that might lead to injury. And we're analyzing how we can use this technology to monitor people in their homes. We go to the next slide. And then we're also very interested in wearable technology and garments that you can measure. This is a garment that can provide stimulation to your muscles for people. And then we also have garments that may be able to monitor your heart rate. Sorry about the background noise. If we go to the next slide. So the take-home message really is, it is time to take care of your health, and that you shouldn't put off the visits that you need to have. We all have to avoid, we've all been sitting a lot during this pandemic, and it's important for us to get back to exercising. We believe that telehealth is likely here to stay, and there's a number of ways you can participate in that. It does have some limitations, and some of our research at UHN is working to improve our ability to monitor people in their homes and deliver remote care safely. So that's my messages, and I'm happy to pass it on to our next speaker, Dr. Abby.